GLP-1 agonists, such as Ozempic, have been all over the news and social media, touted as these miracle drugs for weight loss. But much less talked about are their potential benefits for mental health. And as a psychiatrist, that's what I want to talk about today. Specifically, I want to focus on its reported benefits to reducing compulsive behaviors. Because people have been reporting more and more often that it doesn't just reduce appetite or cravings for food, but it also reduces the urge to drink, use drugs, shop compulsively, or gamble, among other things. And stick around to the end because I'll definitely be sharing my own clinical observations from having treated dozens of patients who've been on these medications over the past few years and what they've been reporting to me, both good and concerning. And for those of you who are new to the channel, welcome. I'm Dr. Robert. I'm a board-certified psychiatrist. And today, I'll be talking about GLP-1 drugs and their effects on compulsive behaviors. All right, so first off, let's quickly do an overview of what these GLP-1 drugs are and how they work. GLP-1 drugs were first developed for the treatment of type 2 diabetes and later approved for weight loss. GLP stands for glucagon-like peptide, and basically it's a molecule that mimics or is very similar to a molecule that our own bodies make to help create a sense of satiety, reducing our cravings for food, appetite, and lowering blood sugar, among other things. And what's really fascinating from a mental health perspective is these GLP-1 drugs also modulate there are circuits in our brain that are responsible for reward, motivation, and impulse. And that's where compulsive behavior lives. And now we get to a real critical teaching point, the compulsive loop. And this is a circuit that's very similar in many types of behaviors. I'm talking drug addiction, skin picking, online gambling, shopping, you name it, that's kind of compulsive nature to it. It's involved in this loop, and it's a very similar pattern seen across all of these behaviors. I would say all of us have some degree of this. Think about that urge kind of building up and then engaging in the behavior that brings on some relief. And then our brain kind of learns over time that if we feel this tension, whatever cues it, whatever brings it on, we can engage in this behavior and it brings on relief, at least in the short term. And the brain learns, do it again, do it again, do it again. And over time, it no longer brings pleasure, but it just brings relief. And tension mounts and we need the relief even more. And it becomes less about seeking pleasure and more about escaping discomfort. And that's kind of the central point of all addictive behaviors. This compulsive loop is driven by dopamine in the brain. And GLP-1 drugs appear to modulate this dopamine circuit. They don't block it, they don't stop it, they don't work directly on dopamine, but they seem to have an effect of how strongly the circuit is fired. They seem to reduce how urgent and important the urge feels. Patients don't feel like they're numb, they don't feel like they have no motivation. That's not what they typically report. But what they often do say is, I feel less of an urge, I feel less of a need to act on an impulse, on an urge. And that gives a lot of mental freedom for many people. And what's really interesting is in 2025, a lot more studies came out that looked at this in particular. What are the effects of these medications on compulsive behaviors? And though there's still a lot more research that needs to be done and more evidence that needs to be provided, there does seem to definitely be a beneficial effect of reducing compulsive behaviors. There's definitely a lot of studies supporting that. But they're still small, underpowered, and I think we'll get a lot more data in the coming years. So now I'll talk about my own observations from my own patients, dozens of whom have been on these medications over the years, along with what my colleagues are also saying about this. And to be clear, these medications, GLP-1 agonists, are not established treatments or verified treatments for compulsive behaviors. These are just observations, and they may have a role in this in the future. I want to make that clear. So I've certainly had my patients who've struggled with gambling, with online shopping, and they have certainly noticed huge reductions in their urges, compulsions to do that since starting GLP-1 drugs. Not all across the board, but I've definitely heard that. Also with alcohol cravings. I had many patients who really struggled with reducing their alcohol intake. And since starting these medications for diabetes, for weight loss, they've noticed, all of a sudden that urge to drink whenever I go out, the urge to drink on weekends, it's kind of still there, but they don't feel like they need to act on it. It's much, much easier to say, hey, I think I'll go without. It's definitely led to a lot of issues in my life. And now I have the bandwidth, the ability to sort of say no. Same with cannabis and other drugs. Another interesting one that I've had in some patients, but not all, and a lot of my colleagues have reported this as well, is skin picking, right? Because that's also a compulsive behavior, skin picking and hair pulling, which is called trichotillomania. And there's definitely that sort of compulsive loop involved. There's an urge, there's a tension, there's a desire to do something. And sometimes even feeling the dry skin, feeling the hair bulb. There's a certain tactile pleasure from that. And there's a lot of tension that's relieved by engaging in the behavior. Even though someone doesn't maybe necessarily want to keep doing it, it's leading to issues. but they are stuck in that loop. And I've definitely had patients on GLP-1 drugs that have noticed all of a sudden I can sort of just not do the skin picking. I can just tell myself, wait, I have an urge to pick my hair, pull my hair, but I'm just not gonna do that because I don't want to keep doing that. So they seem to have more control over these behaviors, interestingly enough. And another interesting area where there might be some role for this in the future is OCD. And as some of you viewers may know, one of my primary focuses in my own private practice is treating OCD. I have seen some patients have some reduction in their OCD, but also not consistently and not always that much. And I think that might be because the compulsive loop in OCD isn't the same. It's not, the compulsions just aren't as pleasurable as they are in addictive behaviors, that there is some reward aspect to it. So maybe that's why it's not as robust of a signal there, at least in my small degree of observation. I think there's going to be a lot more research done on that. Maybe some other medications are similar to GLP-1 drugs that could have some effect on OCD, but I think that's still a while away. But it's not all good news. It's not all good things I'm hearing about these drugs or reading about them as well. There are definitely some potential consequences, so let's go over those. The main one that I've seen in my clinical practice and heard from colleagues is the rebound effect. And that's that if people then decide to stop for whatever reason, because people do have side effects to these, they're not without side effects. Some people get a lot of bad nausea, vomiting, intestinal obstructions, other issues coming up, even mental health, signs of depression and just heightened anxiety as well. All of those things can happen for people. So then they have to come off or stop these medications. And then typically if they did have some benefit to a reduction in drinking, other compulsive behaviors, then we see a rebound effect. So then the urge may even come back stronger for a short period than it was before starting the medication. So that's definitely something that may potentially happen for some people. And I've certainly had some patients that tell me they feel kind of stuck on these medications because if they come off of them, then some really problematic behaviors that they were dealing with that now are under control and their life is much better might come back. So these medications are certainly not a cure for anything. They are just a treatment for certain things and they come with their risks and benefits. And they're still very early on in their development, their implementation in society. So I'm sure we'll still have many things that we'll learn about in coming years that are both good and bad. And then the final thing I want to talk about that is an area of concern for me with these medications is also their impact psychologically on people's relationship with food, their self-esteem, and their bodies, and even their compulsive behaviors as well. Because I've certainly seen that maybe people had some degrees of body dysmorphia, some degrees of disordered eating before starting these medications. And once they do start them, because now they do have a higher focus around restrictive eating, their body image, then it can definitely exacerbate some of those underlying psychological struggles that they've been dealing with. That's why I think it's so important for many people who are on these medications to also have a therapist or a psychiatrist or some sort of mental health provider monitoring their symptoms as well, because it can definitely exacerbate some underlying mental health concerns. And these medications are often prescribed by primary care providers. So they have some training in mental health and screening and things like that. But at the same time, they don't have the bandwidth in their practices to sit down and go over all the psychological aspects of this, or the training to really get into the nitty-gritty of compulsive behaviors, self-esteem, body dysmorphia, restrictive eating, and all these other aspects of mental health that are very relevant here. So I do think that mental health providers will have more of a role in the monitoring and potentially even prescription of these medications. That's another thing I want to clarify is right now, as of now, a psychiatrist probably should not be prescribing this medication. I definitely don't prescribe GLP-1 drugs. I only have patients who are seeing their primary care physicians and they're prescribed these medications by them. So to wrap things up, for right now, I think these GLP-1 agonists are a very interesting, very potentially beneficial medication for not just weight loss, but mental health symptoms. But I also definitely take some caution. I think that it's very early in their development, implementation. A lot more research and studies need to be done on its effects on mental health. And I definitely see them having some role in the future. I hope you found that interesting, informative. If you'd be interested, definitely leave comments down below about any questions, comments about GLP-1 drugs, or if you're interested in me talking more about this, more about some of the studies maybe that came out, or its potential effects on mental health, I'd definitely love to do another video if you're interested. Thank you so much for sticking around to the end. I really appreciate it. Any likes, subscriptions definitely go a long way in this still new YouTube channel. And thank you very much. I'll see you next week.